Good morning, everyone. Today we have Mrs. Danielle Covey, and she's going to be speaking to us about what it's like to be a flight nurse, how her daily routine exists, what that entails. Also, what is her education and what additional training has she gone through? She'll share some highs and some lows of her day. Also, how has COVID-19 impacted her work routine? Thank you so much for joining us, everyone. I ask that you mute all lines, and any questions you may have, please put them in the chat box. Thanks again, Danielle, for joining us.
Hi, everyone. I'm Danielle Covey, like Raquel said. I am a flight nurse for Halo Flight in Beeville, Texas. I'm just going to go through a PowerPoint so you guys, I have some pictures for y'all and talking points. I've been a flight nurse for about almost 9 years now. I've been a registered nurse for almost 14 and a paramedic for about 10. So we'll get started in the PowerPoint. So I just put a little quote in here. It's something that really speaks to me, Maya Angelou's quote that says, "I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel." So as a flight nurse, we always try to say that we are the best part of someone's worst day. So if you're getting flown in a helicopter, usually you are pretty sick, or you've had some sort of traumatic injury, or maybe it's your child that's being flown. It's usually a pretty stressful time for most folks. So that's something that kind of sticks in my head every time I go on a call. So I just wanted to share that with you guys. So this is my current helicopter, my current office, as I like to call it, the Bell 429. Like I said, I work at Halo Flight. We're a nonprofit air ambulance service out of Beeville, Texas. And this is a twin engine aircraft. We do have the capabilities to fly in the clouds like an airplane, where some single engine aircrafts don't have that capability. So we have a little bit more wiggle room as far as weather is concerned in getting to our patients and getting them to where they need to be. So what I do on a daily basis. So I provide transport via helicopter. It's always helicopter, from small hospital to large hospital, sometimes with more patient services available. So say something happened here in Victoria and they didn't have a specialty service like oncology for cancer, or the cancer doctor was out here. So we would take that patient to MD Anderson or some other bigger hospital in a bigger city like Houston, San Antonio, Austin, or Corpus, where they would have those capabilities available. We also respond to 911 scene calls just like an ambulance. So we are an air ambulance for car crashes, people who fell, any kind of trauma, heart attack, stroke, any kind of medical emergency that's time sensitive. So we do that as well. So basically the ambulance makes the determination on scene that we are to come to the side of the road, or they're going to meet us at a designated landing area. And they're going to hand off the patient to us to get them usually to a bigger city is typically what we do with those patients, because they need some, like I said, services that aren't available here. The hospitals here in Victoria are level 3 trauma centers. In Houston and in Austin, in San Antonio, we have level 1 trauma centers, and in Corpus, we have a level 2 trauma center. So level 1's the highest level of care for trauma. So we usually wind up taking them to those areas. They have a surgeon on staff 24 hours a day. They're a teaching hospital. There's a bunch of people waiting to care for that patient once we get them where they're going. And we also ensure the safety of the crew and the patient on every mission. So obviously safety is one of our #1 priorities. We're not getting anyone anywhere if we're not doing it safely. So that's super, super important that we follow all the safety guidelines basically on every mission. So it's actually our number 1 priority before anything else. All right, so what kind of patients we transport? We transport trauma patients. I put a picture of an 18-wheeler crash that we had went to on the side of the road. That's our 18-wheeler rollover, so you guys can kind of see how damaged that vehicle is. We take care of pregnant women with complications or early labor. So women who with multiple pregnancies, so they have twins or triplets or quads or whatever, or they start labor early. So early labor is considered before 36 weeks gestation. So if they're in early labor, we take them somewhere where they can deliver the baby and take care of mom. And sometimes they'll have like high blood pressure early on in pregnancy, and that's not good for baby. So we'll take care of the pregnant woman as well, or even early on in the pregnancy. We also take care of children. Obviously, we do pediatrics. We do every age from newborn, so for everything from day 1 until the end of life. So there's not an age limit or an age minimum for any of the patients that we transport. You can see in the bottom right-hand corner of the screen, that's a baby that is about 3 weeks old, was transported from one NICU, so neonatal ICU, to another. And then we also take care of medical patients. So medical patients, I mean strokes, heart attacks, and most of our medical patients are time sensitive or critical in condition. So they need 2 people. So when you're in an ambulance, you only typically get 1 attendant in the back of the ambulance. There are 2 of us in the back of a helicopter to help take care of that patient in case they were to deteriorate in flight. So our capabilities, what we're able to do, we are considered a mobile intensive care unit. So we can do every single thing that they can do in an ICU. We have invasive line monitoring, we can hang IV drips, we can breathe for the patient through our ventilator that's pictured at the top. That's the EMV ventilator on the top made by Zoll. And then the IV pump is down below. That's our Alaris pump. We have 3 channels on that pump, so we can give up to 6 drips on a patient at a time. We carry 2 of those pumps. And then we also carry blood aboard every flight. So within the first 30 minutes of trauma happening is the most sensitive time to get someone blood if they need blood. So we try to get blood on board if the patient is losing blood and needs more blood as soon as possible. So we do carry it in a cooler on every flight and administer if the patient needs it. We also get the patient to their destination in half the time of a ground ambulance or less, like I said. Sometimes these patients are just a time-sensitive case. They just need to get somewhere and they need to get somewhere fast, and sometimes we're called for speed rather than our ability. So it just kind of depends on the patient. We do education with the ground crews, the ground EMS crews, to let them know what we're used for, so that we're utilized for the right reasons on the ground. So as I said, we also educate the public on helicopter and public safety topics. So we talk to them about how to move around a helicopter, how, not to drink and drive, not to text and drive. We show them, different pictures of stuff, wrecks that we've made. We educate them on breast cancer awareness. We do a lot of education in the public in our downtime, our off days, to make sure that people are getting the education out there that they need, because that's how people keep from getting sick. The education is what teaches them, what they need to know to prevent certain disease processes. We get to attend public events. So we go, and I actually got to fly Santa Claus. He came and hung out with me for a whole day. So that's a fun part of our job. We get to hang out in the community and talk to people about our helicopter service. We bring the helicopter with us on a lot of different public events. And we show people, what we do, and let them take a look inside the helicopter. There is a helicopter here in town at Citizens that my husband actually works on. If you guys ever see anybody outside, you can stop by and take a look at the helicopter. We love talking to people about, what we do and whatever. As long as the helicopter's not running, obviously, you can stop by and, they'll be happy to show you around. Everyone in every helicopter I've ever worked for loves talking to the public because people are interested in what we do. So what inspired me to want to be a flight nurse? That was on here. So I'll tell you a little backstory about me. So I was in a horse accident. That's me. And my dad, when I was a little kid on a horse, I was in a horse accident when I was 11 years old. The horse had reared up, the back legs gave out, and the horse rolled on top of me and the little boy that was on the horse with me. The little boy who was on the horse with me was flown from my pasture. And after that time, I just thought these angels came down from the sky and took care of this little boy and took care of me, made sure I was okay because I wasn't as hurt as he was. And I just thought it was a really cool job. So at that point, I decided that I wanted to do something that could give back to my community, something that was super neat. And so I started chasing my dream of being a flight nurse when I was probably about 14 or 15 years old. So as far as schooling, I had to go to nursing school, so it's 1 year of basics and 2 years in an associate's degree program. That's the very minimum that you can do. So you get an associate's degree in nursing. That's my degree on the right-hand side of the screen, associates in applied science from Blinn College, which is where I went to school. Then I did a 1 year transition at University of Houston, Victoria to get my bachelor's degree in nursing. That's completely optional, but there is a pay raise, so it's a couple of more dollars an hour if you're interested in that. Then you have to take a state test to become a registered nurse. So after I finished my associate's degree, you have to take the NCLEX exam, which is the nursing exam. That's a state board test to make sure that you're safe to practice as a nurse. And then I did a 1 year transition to from RN to paramedic at Houston Community College when I worked at Memorial Hermann in Houston in the trauma department to become a paramedic. So I did a transition program. There's only a few of those transition programs in the state, and that's also optional. we fly a configuration of nurse, pilot, and medic. So I wanted to make sure that I could fly as either. So I went ahead and got my paramedic. And then there's a national test after you start flying. It's considered on-the-job training, called a CFRN, which is basically the Board of Emergency Nursing gives that test, and you get basically get wings, right? So you're a certified flight registered nurse. You can fly without your CFRN, but it's usually within 1 year of hire that they want you to get that certification, showing that you are designated as a flight nurse. So you've learned all of the specialty stuff that we do as a flight nurse, and you take that test, like I said, usually within 1 year of hire, not required before you start. So basically all you need to get started, if this is something that you're interested in, is an associate's degree in nursing, your NCLEX, you pass your NCLEX to become a nurse, and then you need about 3 to 5 years in a busy level 1 trauma center or a busy ICU. So those are the requirements for flight nursing. Flight paramedicine is a little bit different. It's usually about 5 years in a busy 911 service as a paramedic. So those are 2 different things. I went the nursing route. So
Danielle, what about CEUs? Are they different from a regular nurse?
absolutely. So with this, for regular nursing, your license goes up every 2 years, and you have to have 20 CEUs, which isn't very much, right? You think that's not a ton, 20 hours in a couple of years. But for my paramedic certification, that's another 60 to 80 hours of CEUs. And then for my CFRN, it's over 100. So that's even more to keep up with. I have to do a lot of continuing education. I go to a lot of conferences. I'm fortunate to have a company that does pay for me to attend conferences in different states. Sometimes they're 2 and 3 day conferences where I can get like 16 hours at a time. So we do have a lot of continuing education. The CEUs go on, but that's how we stay current. And that's how we make sure we're doing what's best for our patients in our practice. So we love education. That's how we can, like I said, stay current and continue to learn and grow in our profession, because science is always changing, right? Medicine is always different.
And are the certifications and licenses transferable from state to state?
So if you look at the bottom where it says National Registry of Emergency Medical Technicians, so you, as a paramedic, you can either be state registered, you have to have your state, right? So that is normal for a paramedic. But if you have your national registry, that's more hours of CEUs, but it's transferable to any state in the entire United States. So you can go anywhere as a paramedic. As far as nursing is concerned, there's a compact license, which you can sign up for when you take your NCLEX, which is your test to become a registered nurse. It's about 20 states, I believe, and you can transfer to those states. Other than that, you actually have to take another test or get what they call reciprocity to that state if you move somewhere else. So the nursing license is a little bit harder to transfer. The paramedic national registry is not so hard. The certified flight registered nurse is good across the world. Actually, that is a worldwide certification, so that can actually go anywhere. All right, so I said that our crew is made up of 3 people. This is me and my partner, Stephanie. I actually was a paramedic this day. She's a nurse because I'm both. Typically, I fly as a nurse, but this day I just happen to be a paramedic. And we also have a pilot who flies us. The pilot has no medical training whatsoever. They just are there to operate the aircraft and make sure it's safe to do so. They usually have to have about 2,000 hours of flying before they ever come to us. So it's not some guy we just pulled off the street who just passed his pilot's license test. They usually are ex-military. That's typical because that's where they had to have work to have the hours that they have to fly us around. All right, so how I started out, this was my first flight job. It was in Pearsall, Texas, which is about 45 minutes south of San Antonio. We opened up a base here for Methodist Air Care. And I finally found a company that would hire somebody with not a lot of experience because it was a new base. I started my career there and absolutely loved flying. That was just my first experience there. And then I moved back. This is actually in Austin. We're on the helipad at Brackenridge, which is now Seton Hospital. And I got to move back to Victoria, which is where I grew up. I was born and raised here in Victoria. And I got to take care of some of the people that I call my family and friends, which was really neat to see for me. And then I was there for a few years and I wound up going to, oh, my hair is really short in that picture. So I wound up going to my current employer, which is Halo Flight. I decided to work for Halo Flight because they're a nonprofit air ambulance service. So we're a little bit different than some of the other companies in Texas, as we basically, if people have trouble paying their bill, we are a nonprofit. So we're a charity organization. We donate a lot of our flight, basically our profits. We don't really make any profit every year. We basically make sure people get from point A to point B, whether they can afford it or not. So it was kind of on my heart to be a part of a company that is that way, is a charity organization, because some of the bigger companies obviously want to make a bigger paycheck. And so I actually wound up working here, and I've absolutely loved it. They really do take care of their patients. So I feel like it was a good career move for me to work there, and I'll probably be there until I retire. So let's talk about paycheck. Your salary is based off 48 hours per week. That's a standard. We work 2 24-hour shifts. We live at the base for those 24 hours. So for 24 hours, your life is at the base. You're on call just like an ambulance. You eat at the station or the base. You stay there, you sleep there. There's a bed there for you. There's a bed for a pilot, a nurse, and a medic, all 3 different rooms. You get your own little space. And we work 2 24-hour shifts a week. So that's typical. Salary starts at about $70,000 for a flight nurse, and that's without overtime. So you can make well over $100,000 based on overtime. Just depends on how much you want to work, or if there's overtime available at your company. And your salary starts out based on how much experience you have. So if you have all the requirements, all the certifications that we talked about, the CFRN, that's all pay raises. Your bachelor's degree is more. There's a whole bunch of things that you can get, certifications that you have to have, that will increase your pay. So if you have them all when you start off at a little bit higher pay rate. So they wanted me to talk to you guys a little bit about how COVID-19 has affected my job. That is my picture. My last name is different. I just got married, so that's why my badge is different, but that is me with the mask on. So now we're required to wear a mask on every patient flight. I'm obviously talking to you guys via distance education. I'd love to meet all of you in person, but that's how COVID-19 has affected my job. We're not doing as much public relations stuff. We also screen all of our patients for COVID symptoms prior to loading them in the helicopter, because our pilot is not medical. So he's not protected unless we protect him, right? So we have to make sure that all of our patients are screened before they get put in the helicopter, to keep our pilot safe, keep him well, make sure he's able to keep flying us around. And we also use inline filters on all our ventilators now. So anybody that's put on a ventilator gets a filter. We typically weren't putting filters on there because we thought, you're just breathing regular oxygen like you or me. But now that we don't know who has COVID-19, everyone gets a ventilator filter. So it's a little bit about how COVID-19 has affected my job. We've seen a lot of sick people. We've transported a few COVID positive patients to higher level of care, and they are very sick. So if you want this to be the view from your office, that's a daytime and a nighttime view. You might consider a career in flight nursing or paramedicine. So that's my superhero picture on the right-hand side. That was when I first started working. Does anyone have any questions for me? I'm going to turn the PowerPoint off and come to the screen.
Danielle, what suggestions or words of advice would you have for extracurricular activities during their high school years?
Okay, so I will tell you that in the field of nursing, this is not extracurricular, but it is a pointer for you guys. So I had my first almost year of nursing school paid for, and 1 semester of my transition from my associate's to my bachelor's degree paid for. There is a lot of money in health science fields for scholarships, y'all. So if you have any interest in health science at all, obviously you're on here, so you have some sort of interest. It's super, super important to apply for scholarships if you need money. There's so much money in the community for health science scholarships. People especially, are just looking for people that want to better themselves and help out in their community. So write the essay, fill out the application. Some scholarships I got were literally 1-page application. So I will tell you that. And then the other thing that I can tell you that helped me throughout my career or getting started was to absolutely do community service. Do work, volunteer somewhere, whether, if it's health sciences in vet school, or learn what it's like to be around the hospital environment. So that way you're used to seeing patients on not so good days. It can be a very emotional job. And we have, it took a long time before I got used to seeing some of the stuff that we see every day. Volunteer, give back to your community, show your future employer that you are interested in giving back. And so that shows your heart. Obviously, if you're interested in health science, you have a heart. I know you do. So that would be what my advice to you. Like I said, apply for scholarships, because there's plenty, especially if you stay locally at Victoria College or at University of Houston, Victoria. Out of the 30 girls I went to school with for my transition from my associates to bachelor's, 10 of us got our first semester completely paid for. So there's lots and lots of scholarships out there. Just apply, guys. What are they going to tell you? The only thing they can tell you is no. So community service is awesome. Volunteer at the hospital, be a pink lady at Citizens, help people get around the hospital, talk to people when they're having bad days, spend some time doing that. So that'll expose you to a little bit more of what people are going through when they're hospitalized, when they're having a bad day. I got a question from Kisha. So could this cure be modified for persons with disabilities? There's modifications for a lot of things. I had a paramedic partner for a while who only had one hand. And he was able to do everything. He learned how to do all of the skills that we do, starting IVs and all the things with one hand. It would depend on the disability. If you have something like dyslexia, there's absolutely ways that we could get around that. It just kind of depends. That's kind of a broad topic, but definitely you can get in touch with someone who works here locally or with me. I'll be happy to share my email with you guys if you want that. I'll put it in the box right now. If you have questions, I can try to answer them for you. If you don't want to put your information out there about what kind of disability you're talking about, I have no problem. I put my email in there. You guys can email me with questions you have, especially if they're personal questions. I have no problem answering them. Anybody else have any questions? Or Raquel, do you have anything for me?
Yes, ma'am. What about soft skills? Obviously, empathy would be high up on the list, but what other soft skills would be needed for your role?
So empathy definitely is at the top. Patience. So sometimes we have family members who don't understand why we're doing what we're doing. The ability to articulate with empathy what's happening to someone. Those are awesome. And then the ability to control your emotions. So I would say that would probably be top of the list, because there's days where you're human, right? So you're affected by what you're seeing and everything that you've gone through that day, and to be able to control your emotions and to keep yourself in check and to be the strong person for the family that's going through what they're going through and you're dealing with, definitely plays a part in that. And then also, as a first responder, I'll tell you the ability to be self-aware that you may need counseling. So that's a huge thing. We have a huge rate of PTSD in our field, because we see, babies that were injured, or we see people that pass away. And so to be self-aware that you are struggling with something is a huge deal to me. I see a counselor regularly, not because I'm crazy, but because I have to vent to someone. I'm fortunate enough that my husband is also in the same profession that I am. So we, debrief a lot kind of at home. But definitely, like I said, being self-aware of your emotions and the fact that you are still human in doing this job. No one's a robot. We don't expect you to be a robot. But we expect you to pay attention to how you're feeling so that you can continue to do the job that you love. Kisha said, is there a counselor on site? So we do not have a counselor on site. We have a 1-800 number. That's a hotline we can call if we're having issues. If we have a really, really bad call, so say I went to the scene of a helicopter crash. So obviously I fly in a helicopter, and that's everyone's worst fear whenever you fly in helicopter. And if you go to a helicopter crash, obviously you start thinking the worst. We can call in a STRAC team. So it's a team that will come in and counsel everyone. So everyone that was involved, in this, whatever flight, the pilot, the nurse, the paramedic, the crew that they handed off report to in the morning, whoever needs to be counseled, we can use that service to bring them in. They are not on site all the time, but we can bring in a counselor whenever we want. My company and my insurance, either way, both pay for a counselor for me to go to anytime I want to go. So it's completely paid for, and we're taken care of 100% so that we can stay well for our patients. Does anyone else have any questions? I'm still looking at the chat box, so I just wanted to see if y'all had anything.
With no further questions, guys, I want to appreciate you all for connecting in so early this morning. As Danielle did state, feel free to email her if you'll have any other questions or concerns that you might want to have addressed. Or you can relay that to me and I could forward them on to her. I appreciate you, Danielle, for being willing participant. Thank you so much for all the knowledge and insight you've shared with us this morning. May you all take care and have a wonderful day.
Thank you, ladies and gentlemen. Have a great day.